Hi, welcome to my PowerPoint about instructional teaching methods, which I did on field trips. So first I'm going to go over the importance of field trips during education. It's often considered a class favorite for most students. Research has actually proven that field trips are a multi-dimensional learning experience, and they serve to make educational connections between the classroom learning objectives, so in-class learning, and fun, real-world, hands-on learning experiences, which complement each other. Field trips have been reported to improve new knowledge retention in learners through experience-based learning, so basically like hands-on, kinesthetic type of learning in comparison to just content classroom-led learning where you're reading a book or looking at lecture slides. So field trips aren't just done kind of on a whim. There's a lot of planning that's involved in doing field trips. First, educators must produce a detailed plan of the field trip so that it reflects class content. So whatever you're currently learning in the classroom, it has to closely correlate with the field trip experience. So the location of the field trip must be carefully chosen so that the experience complements the classroom objectives and helps to leave a lasting impression on the students. And if possible, field trips should have several instructors along to provide small group instruction. Bastable actually points out that cognitive learning actually is improved when there is one-on-one instruction rather than large group instruction. The location of the field trip and the activities involved in the field trip should really reflect the classroom content, as we discussed on the previous slide, so that the content meets real-world experiences. And lastly, field trips aren't just leaving the classroom and having a fun experience. There's often some kind of a written or educational activity that is paired along with the field trip, so that students can help summarize their educational experience and relate it back to those classroom concepts that they were learning. So common field trip locations, and this is primarily for like secondary and really secondary K through 12 learning, would be like libraries and museums, whether it be historical museums or art museums, historical sites like Gettysburg, the planetarium, the zoo. I also provided a short video, maybe about 3.5 minutes long, about an early childhood classroom going to an art museum, and you can see in the video that the students are learning about classroom concepts in the art museum itself. So often field trips are taking place at culturally diverse locations rather than places like an amusement park or a movie theater, which are considered reward-based experiences. Next up, we have the 3 different domains that field trips fall under. And actually, I found that field trips can fall under all 3 of the major educational domains according to Bloom's taxonomy, which are the cognitive, affective, and psychomotor domain. So first up is the cognitive domain, which is the thinking domain. Field trips can increase a learner's knowledge of a particular subject and help broaden their horizons. And while field trips are often conducted in a large group fashion, students can be paired off into smaller groups to provide better one-to-one instruction of new concepts. And this is actually the point that I was discussing earlier about having multiple instructors go with you, or even volunteers, so that you're able to do more one-to-one instruction. Next up is the affective domain, which is the feeling domain. And field trips can enhance a learner's perceived value of an educational experience. So what I mean by this is that they're sitting in a classroom and learning about a new concept, and they're not really interested or intrigued or motivated to learn. But you put the student in this experience-based learning, and the learner's attitude towards the new information can become more positive and actually benefit learning. And lastly, we have the psychomotor domain. Field trips provide hands-on learning experiences, and the purpose of field trips is really to provide those real-world connections and critical thinking experiences that correlate back to the classroom teaching, where the learner is able to physically interact with their surroundings. And next up are the pros and the cons of field trips on educational experiences. Field trips improve critical thinking by encouraging the learner to make connections between the classroom content and real-world experiences. Field trips help to differentiate material for learners who have more of a kinesthetic learning style versus just a visual or oral learning style. And field trips can help bridge the gap between those students who are economically advantaged and those who are not. So someone who wouldn't otherwise be able to attend an art or a history museum would be able to go through a school opportunity. The cons are they can be costly to the patient or the learner involved. For example, and this is one of my examples for field trip learning application to healthcare education, patients in labor and delivery actually have the opportunity to take a 1-hour tour, but it is a hefty price of $70 for this tour. In addition, field trips are often performed with a full classroom of learners, maybe 20, sometimes 30 plus learners, and therefore they're run on a tight schedule, and they're very structured, and they can be difficult to engage every individual person. And also, research has shown over the years, instead of field trips being a culturally enriching experience, they've been moved to more of a reward behavior experience. So common sites now include amusement parks, movie theaters, instead of museums. So on to the examples of application to healthcare education. So how can we apply field trips to healthcare topics for both patients and peers alike? So field trips are obviously very difficult for patients who are admitted to the hospital, but they can be very beneficial for patients who are being seen on an outpatient basis and as educational opportunities for healthcare staff. So the first example would be a 45-year-old male who's scheduled for a total knee replacement. In order to educate and prepare the patient for the process of a knee replacement and the subsequent post-operative care, the patient can be sent informative brochures and information about his upcoming surgery, and also given a tour of the floor of the hospital where he would be recovering and performing physical therapy. So they would be able to tour the equipment and have an opportunity to have hands-on experience with that equipment and ask questions. Second example we kind of discussed earlier is a young couple who's interested in attending a tour of the labor and delivery unit prior to having their first baby. The hospital where they are to deliver offers both an on-site and virtual tour of the unit and the amenities provided. This hands-on experience allows the young couple expecting to tour the labor and delivery, postpartum, and NICU rooms, and they can be introduced to the various methods of pain management and the healthcare team. And the last example I have is a new nurse who's been hired to work in home health care and work primarily with patients who are diagnosed with diabetes. So the new nurse can attend a one-to-one educational session or experience with a diabetic educator at their office, and they can review pertinent education that can be provided to the patient. They can have hands-on experience with the medication, withdrawing up insulin, using the needles, proper injection technique, signs and symptoms, keeping a log, going over dietary concerns, so that the nurse can provide the most up-to-date information and practice skills. And then the last page here, we have the references that were used during the course of this PowerPoint. Thank you for listening.